As folks come in, we'll let them in. So good morning, good afternoon, good evening, wherever you are in the world. We're very happy to welcome you to this information session organized and convened by the AMR Multi-Stakeholder Partnership Platform on the progress made towards establishing the Independent Panel on Evidence for Action Against AMR, or affectionately known as IPEA. We are pleased to have colleagues from the Quadripartite Organization with us today who will share the latest updates on this work. So the objective for this session is to ensure that stakeholders from all sectors, those who contributed to, are interested in and followed the process, has the opportunity to be informed and updated on this important global progress. This reflects the spirit of the whole of society approach, and the MSSP is the place where we connect stakeholders from various sectors, disciplines, levels, and regions to global policy processes, build consensus and a shared vision, coordinate and collaborate on AMR applying the One Health approach in practice. So welcome to you all. My name is Ashni Moodley. I chair the MSSP Steering Committee, co-chair of the Research and Academic Organizations Cluster. And I'm a joint appointee between the International Livestock Research Institute in Kenya and the University of Copenhagen in Denmark. And I'm delighted to be your host today. So just a little bit of housekeeping and a bit about the process. Today's session will last for a maximum of 2 hours. It is a dialogue where the quadripartite organizations are invited to provide updates on the progress towards establishing IPEA. You will hear about the proposed panel model, its governance structures, functions, how the panel will operate, the role of different stakeholders, and the way forward. Please note, this is not a consultation process, but rather a moment to pause and present what has been done since the multi-stakeholder consultations that were held in September, which were also hosted by the MSSP. Those consultations were extremely informative and constructive, and they enabled the quadripartite to adjust documents and the proposed model based on those rich discussions and feedback. On behalf of the MSSP and the quadripartite, we thank all stakeholders who contributed to those discussions and shared their vision and expertise. The summary report of the consultations is now finalized and will be published shortly on the MSSP webpage. Today, we'll start off with a presentation from the quadripartite. Sorry, please can you mute yourself? And when we are ready to take your questions, you will be invited and then you will be able to unmute. So as I was saying, the summary report from the consultations that were held in September are now finalized and will be published shortly on the MSSP website. And today we'll start off with a presentation from the quadripartite, followed with an extensive Q&A session. We invite stakeholders to raise their hands and you will be invited to take the floor during our Q&A session. You are welcome to submit questions in the chat box, which we will monitor and address them during the same segment. As you may know, the quadripartite organizations have open written consultation for their members on the founding documents, and these consultations are open from the 11th to the 25th of November. In the chat box, you will find a link to the QJS website where you can access the documents and the survey for submitting written contributions. This is for the government, for the member states. For non-state actors, your window for direct input was during the multi-stakeholder consultations in September. However, if you still want to engage and provide input, this can only be via comments shared to your member state. Once the member states have provided their feedback, the quadripartite will then review and revise the documents accordingly. Please note that documents will need to have a legal review as well. Lastly, I'd like to point out this meeting will be recorded. And with that, I'd like to hand over to Jean-Pierre Nemazim, the Acting Director of the Quadripartite Joint Secretariat on AMR, for a brief welcome remarks on behalf of the Quadripartite. JP, over to you.
Thank you so much, Ashley. Great to have you, and thanks for you and MSPP for hosting us today. And a warm welcome to everyone who has been able to find time and turn into this info session. It's wonderful to see such a diverse group gathered here. And as you rightly mentioned, Ashne, for us today is to walk you through the proposed scope, functions, structure, and key considerations for the establishment and operationalization of the panel. I hope you have received all the documents that we have published more than a week ago. And we understand this important conversation would help clarify and give you more information. And please interact with us, pose questions, and just comment on all the documents and ask even 4 questions. And that's really the purpose for today. Shortly, my colleagues will pass through the documents and will explain to you how the envisioned IPEA is supposed to operate. And they will try their best to describe everything that is in the document, in not just really going through a document line by line, but give you the idea on how the envisioned panel will operate. And as Ashna mentioned, the member states are already in the course of making written comments, and they have until 25th of this month. And we hope to receive lots of comments, and we as well that will give us a picture on how the people and all the stakeholders are really urging the establishment of this panel and how much of their engagement is. Before I conclude, let's not forget this week is the World Antimicrobial Awareness Week. So we started it yesterday, and I'm sure that most of the stakeholders online today have already started to really do a number of activities. The theme is about act now, protect our present, and secure our future. And that's really telling us that AMR is not a distant threat. It's here, and it demands urgent action. And the IPEA, as we discuss it today, is also about providing independent evidence-based advice to guide policy decisions or policy interventions on AMR. And we think having this discussion during this week is also timely, because also we keep gathering the momentum and as well understanding better how this panel will fit into the overall AMR governance framework we have. So let's make this session interactive, constructive, and focused on how should we move forward together. And again, Ashna, thank you so much for facilitating this conversation. Over to you.
Thank you very much, JP. So now I'd like to welcome Jungsha Song, Senior Animal Health Officer from FAO.
Thank you. Thank you very much, Ashley, and thank you, JP. And good day, everyone. I'm very pleased to join our quadripartite colleagues and for this IPEA information session. Let me start with some background, how IPEA came out. The next slide, please. Okay. Antimicrobial AMR is a global health and development challenge affecting multiple sectors, disciplines, which is why One Health approach is essential to address it. To make this happen, the quadripartite organizations, namely FAO, UNEP, WHO, WOHA, joined forces. Our collaboration is guided by the strategic framework for cooperation on AMR, which is jointly developed by these 4 organizations. And the coordination is managed by the Joint Secretariat in AMR, hosted by WHO on behalf of the 4 organizations. So each organization brings unique strengths, expertise. Together, we can make a holistic, system-based approach, and this approach drives our work in several different key areas, including global advocacy, stakeholder engagement, governance structures, multi-partner trust fund, technical working work, for example, integrated surveillance, and also, of course, strategic partnership. Next slide, please. So, significant progress has been made in recognizing the skill and the work of AMR challenge. Countries and partners have been taking important steps, including developing their national action plans. However, the reality is that progress is still remain and slow and uneven, especially in the area where transformative change is most needed. So to tackle those challenges, the UN IACG group was established in 2018, 2019. The IACG report recommended strongly to establish global governance, and the three key structures. The first one, Global Leaders Group on AMR, launched in 2020. The AMR Multi-Stakeholder Partnership Platform, and launched in 2022. And the Evidence Panel on Evidence for Action, which is the quadripartite is now developing, since it was highlighted in the 2024 political declaration. Next slide, please. So this is the UNGA 2024 declaration. In paragraph 30, it was request this declaration invite the quadripartite organizations to establish IPEA in 2026. So, in 2025. The panel will generate and promote the use of multiple sector scientific evidence to support countries in tackling AMR. So this UNGA 2024 declaration also highlighted the panel must be developed using existing resources, avoiding duplication and following open, transparent consultation with all member states on this composition, mandate, scope, and deliverables, and which is why we are here today. Next slide, please. So the quadripartite has established a core group composed of technical experts from each organizations to develop this roadmap for the establishment of the IPEA. This process began in early 2025 and is progressing through the several key steps. So the landscape analysis has been conducted along with the development of the stakeholder mapping and engagement strategy. And then an online survey was carried out to gather inputs on key aspects to consider for the future IPEA. So using all these inputs, a draft finding document was prepared by the quadripartite. So this draft was then consulted globally with a wide range of stakeholders through the AMR Multi-Stakeholder Partnership Platform, MSPP, both virtually and also in written format. So based on the stakeholder feedback, the funding document was refined and a set of supporting document was developed, including the rules and procedures, conflict of interest policy, and work program development process. So the first draft of the funding document and the supporting package is currently being consulted with members through written consultation process from November 11 to November 25. So the members' inputs will be consolidated to the further revision funding document and supporting documents. So the documents will then undergo internal review, including legal clearance from the four organizations. So then finally the objective is to present and launch the funding document during a back-to-back event at UNEA on 10 December in Nairobi, Kenya. So the supporting document will be then finalized once the panel is established. I think I'll stop here and then I'll over to my colleague Azabur from UNEP.
Thank you, Junsha, and good day to all. I'm also very pleased to be here with you. So looking into existing science policy panels, a robust panel usually has a founding document, as Junsha was mentioning, and a set of documents for the operationalization arrangement. The funding document is intended to be as a concise framework outlining, in this case, IPEA's key elements, including the scope and functions and the organizational and governance structure. This serves for the establishment of the panel. Then, detailed provisions regarding the functioning of its constituent groups, including procedures for the selection of members and admission of observers to the expert committee, decision-making processes, development of the work program, preparation and approval of deliverables and mechanisms for identifying and managing conflicts of interest. All those are part of the set of documents for the operationalization of the panel. And these documents, which will set out the panel's rules, policies, processes, and procedures, are to be formally adopted by the panel itself. Most of them have been developed, and these 0 drafts are now consulted prior to the launch of the panel to expedite its operation once established. Next, please. Thank you. Building upon the guidance of the UNGA political declaration, from the example of existing science policy panels, and also from the multi-stakeholder consultations held in September, 4 key functions have been identified and are reflected in the revised draft of the funding document. First is the assessments, conducting independent, robust, and authoritative assessments of current issues and identifying potential evidence-based options to address them. Horizon scanning, identifying and prioritizing overlooked and emerging trends, risks, and impacts, and appropriate responses to these. Knowledge management, sharing information and identifying and highlighting research gaps, etc. And policy support, developing tools and methodologies based on the deliverables to guide decision-making at all levels. Next, please. As mentioned, institutional arrangements set out the architecture required for a panel to operate and deliver on its objective and functions. The structure suggested in the funding document describes the different components of IPEA as represented on this slide. The organizational structure includes the expert committee, which is the decision-making group who provides strategic direction and oversight, ad hoc expert groups that are implementing the panel's work program, including preparing specific deliverables, and the secretariat who gives administrative and technical support to the expert committee and the ad hoc expert groups for the functioning of the panel. It should be noted that all these components together form IPEA or the panel. The role of the panel requires that it pays special attention to issues of scientific independence and conflicts of interest to maintain the integrity, credibility, relevance, and legitimacy of the outputs and processes undertaken, and also public confidence, that it's so important. This is why a conflict of interest policy is drafted as a 0 draft for consideration of the panel to ensure that conflicts of interest are identified, prevented, and managed, avoiding any adverse impact on the panel while protecting the person or people concerned, the panel itself, and the public interest. This policy applies to all parts of the panel, including members of the expert committee and any subsidiary groups contributing to the development of deliverables, and to non-UN staff and partnerships supporting the panel's work. The outputs of the panel will be disseminated based on an outreach and communication strategy, transmitting and facilitating the use of relevant results deliverables to international policy forums, such as the Ministerial Conference on AMR, the UNGA, or the governing bodies of one or more United Nations entities and other international mechanisms, to enhance their impact on policymaking processes and promote action. Next, please. Moving to each of the elements to better understand the functioning, we start with the expert committee. Next, please. As earlier mentioned, the expert committee is the decision-making group. It consists of 30 independent experts in individual capacity with a balanced representation across geography, sectors, gender, and disciplines, including representation of indigenous peoples, regions severely affected by AMR, and experts in economic, social sciences, and other relevant fields. The committee is led by 2 co-chairs and 2 vice co-chairs and have a rapporteur. The nomination and selection of the members of the committee is based on criteria related to expertise and knowledge of the panel's work. They are mentioned there on the slide. And the expert committee will have a representative from each of the quadripartite organizations only as ex officio members, and will also accept observers who qualify in the matters covered by the panel and who had informed of their wish in advance to the Secretariat. It is important to note that the committee will review its composition and functions no later than 2 years following its establishment. To facilitate continuity of the panel's work, members of the committee will have staggered terms, with the aim of ensuring that no more than half of the committee members are elected at a session of the committee. The nomination of experts will be done through an open call for expression of interest, and the election is to be done by consensus, or if the committee decides so, by vote. Next, please. My colleague Silvia will continue with the functions of the expert committee. Over to you, Silvia. Thanks.
Thank you so much, and good morning, good afternoon, good evening, everyone, and a warm welcome on behalf of WHO and of course the quadripartite. So I'm gonna now present you the function of the expert committee that has a core role, of course, in the independent panel functioning. So the expert committee, first of all, will be tasked to lead the development and the approval of the panel program of work and the budget. And this is based on the request, the input, the suggestion of stakeholders, including governments, multilateral agreements, UN entities and other intergovernmental bodies and international instruments and other stakeholders. The second function is about ensuring the participation of observers in an active and efficient way in the meetings of the expert committee. And as well coordinating with other relevant governance structure, instrument and bodies such as the GLG, the Global Leader Group, and the AMR Multi-Stakeholder Partnership Platform, or MSPP, in order to, first of all, leverage existing resources, and number two, really to avoid duplication of ongoing effort. The third task is to oversee the implementation of the panel work, including the allocation of resources, but also providing recommendation on how we can mobilize resources that support the functioning of the panel. The fourth function is related to establishing and managing, in a way, those subsidiary group of the panel, including ad hoc expert group that will be tasked to perform specific output or deliverables. So the expert committee will be tasked to select the members of this group through an open and transparent process. And of course, this is done according to the rules of procedures and the processes and procedures set in relevant documents. The fifth task of the committee is to engage the scientific community and all the relevant knowledge holders in the implementation of the work program, and to make sure that there is an equitable and effective participation of experts in the panel work, such as through capacity building. The sixth task is developing and managing a transparent peer review process so that the output of the panel are trusted, and this can be done with the support of the Secretariat. And this will enable the highest scientific quality, rigor, independency, exclusivity, integrity, and credibility of the panel deliverables. The seventh task is about reviewing, is about approving, is about clearing any deliverable produced by the panel, including any technical report, any summary that is developed for policymaker consumption. And this is done, of course, as always, in accordance to clear processes and procedures that are set out in relevant documents. The eighth task is about communication. So the group is tasked to drive communication, outreach, and the dissemination of the deliverables, the outputs that the panel produce at all levels, including ensuring the timely transmission, facilitating the utilization of the and the interpretation of the findings to any relevant stakeholder, and particularly during in the context of international policy forum, such as the Global High-Level Ministerial Conference on AMR, which is a good opportunity for disseminating and delivering the output of the panel, as well as the UN General Assembly is another opportunity for disseminating the information, as well as governing bodies of one or more the UN entities and other international mechanisms, so that the output of the panel is really embedded and kind of utilized for policy making by the four organizations in the best possible way. And then the last task of the panel, of the expert committee, is about reviewing and approving panel's rules, policies, processes, procedures, making sure that any amendment is scrutinized, making sure that the rule of procedures and term of reference for the periodic evaluation of the functioning of the panel that should be done regularly to make sure that the panel produce and deliver what is tasks to deliver is conducted in an efficient and effective way. Next slide, please. So then the second bodies that constitute the panel are this ad hoc group or subsidiary group that really support the panel in implementing the program of work and specifically in preparing specific deliverables. And next slide, please. And those ad hoc groups or subsidiary groups are established by the expert committee specifically to realize targeted objectives and which are time bound and as I said, delivered by ad hoc expert working groups that have to prepare specific defined deliverables, and this has to be agreed during the session of the expert committee. Now, the expert committee is the body that determine the topics, the matter to be considered by the working groups, the subsidiary groups. The expert committee established the term of reference of any subsidiary group, including the duration of the group and the modality for conducting its work. Now, the expert group shall also determine how the member of the working groups are nominated, how the members of the working group are selected. And this is, of course, once again, based on specific procedures that are outlined in the relevant document. And the expert group is also responsible for making sure that the working groups prepare and produce deliverables that are then clear and reviewed by the expert committee. Any subsidiary group shall elect co-chairs and rapporteur, and the procedure for the preparation and the clearance of the deliverables by the ad hoc expert group are then further defined in a separate procedural document. Next slide, please. And then lastly, there is the last body that constitute the panel, which is the secretariat that is tasked to provide administrative and technical support to the expert committee and to the ad hoc expert group. And I hand over to my colleagues for this description.
Thank you very much, Silvia, for this introduction. And good morning, good afternoon, or good evening. And I hope it's not good night for everyone attending. It's not too late wherever you are. It's a pleasure for us to see you all gathered here, and we continue with the description of how the panel is constituted. So if you can move to the next slide, please. As the expert committee is, let's say, running the business, there is the need for someone to run the house and run the logistics of the house. So this is the main function of the secretariat, who would be, as Silvia was describing, providing the technical and administrative support to the expert committee and other subsidiary groups, the other groups that were mentioned before. Among the responsibilities and the functions of this secretariat, it would be the ones of drafting the work program for approval by the expert committee, as well as the coordination and the support to the implementation. It will also help in the monitoring and reporting progress to the expert committee on the implementation of the approved work program, as well as on the budget, assisting in the evaluation of the panel's work. It will also help in the mobilization and management of the financial resources, as well as managing the contractual and very important legal matters related to the panel. It will also support and help the dissemination of the panel's deliverables, conducting outreach activities in consultation with the expert committee, of course, and it will be organizing the meetings and providing support for those, including the preparation of documents and reports, mainly for the expert committee. It will enable the stakeholder participation in cooperation with the AMR MSPP, the multi-stakeholder partnership platform, and last but not least, it will be also proposing partnerships for consideration to the expert committee and supporting the implementation of any partnership as guided by the expert committee. The panel secretariat is intended to be facilitated by the quadripartite organizations, namely FAO, UNEP, WHO, and WOA, and would be hosted by UNEP. And all the four organizations will coordinate the implementation of all these secretariat functions. If you can move to the next slide, please. Then, as it was previously said, is part of the expert committee functions to drive the communication, the outreach, and the dissemination of any deliverables produced by the panel at all levels, but especially those with policy impact and those who would be taking over the recommendations that the panel is providing for change in the different policies at the national and regional level. So this would be done in a timely transmission and facilitating the use of relevant deliverables to international policy fora, and we would like to leverage from those that are already existing, such as the Global High-Level Ministerial Conference on AMR. Many of you, or most of you, know that the next one will be held in Nigeria by the end of June in 2026, and that there's been established a system of biennial Global High-Level Ministerial Conference. We will also intend to leverage the United Nations General Assembly, as well as the governing bodies of one or more United Nations entities and other international organizations. All this is intended to enhance the impact of the policy-making processes and inform those policy-making processes by sound and compelling scientific evidences that are generated by the panel, namely the expert committee and the subsidiary groups, as it was described before. You can move to the next slide, please. All that, it has to be sustained by financial arrangements, and a dedicated financial mechanism will be made available, leveraging existing ones as well as resources. It will include the collection of voluntary public and private contributions to support the work of the panel, with a due diligence process to avoid any conflict of interest. And it will be governed by the relevant financial rules and procedures that have to be determined by the panel itself. The contributions to the financial mechanism will come without any conditionality and will not orient the work of the panel. They cannot be earmarked for specific activities unless otherwise decided by the expert committee in accordance with the financial rules and procedures mentioned before. In-kind contributions will come without conditionalities from governments, the scientific community, other knowledge holders and stakeholders, and will be key to the success of the implementation of the program. If you can move to the next slide, please. And I hope that we have provided to you sufficient information on how the panel is working. And now we are opening the questions and answer sessions, and it's been a pleasure describing this to you. So I hand it over to our chair, Ashni. Thank you.
Thank you very much, colleagues, for this very comprehensive overview of the process and also the current status of the IPEA establishment. We will now open the floor for questions and comments from participants. Again, if you would like to take the floor, please use the raise hand function in Zoom. We'll invite speakers in the order that the hand appears on our screens. When you are invited to speak, please unmute yourself, turn on your camera if you can, and briefly introduce yourself, stating your name and organization. So we wait patiently for a hand up, and I already see one hand. Kevin Otterson, the floor is yours.
Well, thank you, and I appreciate all the changes from the previous version of this document. The panel is more independent, and thank you for that. Is there an intention to announce 30 members of the panel at the UNEP event? And what support will there be for, say, panel members who are not from a high-income setting? Will they be subsidized in some way to make it more equitable that they should be able to participate? Thank you.
Thank you very much, Kevin, for that. I'll throw the ball to JP.
Yeah, thank you so much, Kevin. And colleagues, feel free to jump in as well. So there are no plans to announce the 30 members at the IPEA. And actually, we can't even say that this is already a given. As you know, we have launched a member states consultation. It's running the entire week until next week. So we can't call it as a final at the moment we are in. So depending on what the member states will send us back as comments, we'll again sit on the documents, revise them, check all the internal stakeholders of the quadripartite. And what we intend to do in December, if all goes well, is really to communicate the final founding document. So past that moment, then coming the next year, if the founding document is finalized, as IPEA described, we'll go ahead and now start the open competitive selection process for the 30 or another number of the expert members. So that's the plan. So December, we won't be there for the 30 or another number of experts, but we hope to have finalized the founding document. I hope that helps. Now, in terms of the representativeness, I think, as again it has been mentioned, it will be an open competitive process in terms of recruitment of experts, but there will be considerations, of course, of the different criteria, including the geographical representation, sector representation, and so forth. It will be transparent. I think the document has described how it will be transparent, and it won't just be done by the quadripartite. It will be open, and criteria will be set, communicated to the public, and the outcome of the selection as well will be public for everyone to know. Back to you, Ashley.
Thank you very much, JB. I'd like to hand over now to Yamanya Tembu from React Africa.
Hi, thank you so much, Ashni. So I think, like Kevin, we really appreciate the positive steps that quadripartite has acknowledged the concerns raised by many regarding the originally proposed very complex government-led structure. So this is a welcome change. And additionally, I think it's really good that we're able to see some of the publishing of the more advanced and detailed policy and process documents. That allow us to better assess the functioning of the panel. I have a couple of questions. One is, with regards the point 2A5, which is talking about the composition and the 4 representatives of the quadripartite, is that 4 in addition to the 30 experts committee members, meaning that the total would then end up being around 34? That's my first kind of question. And then I think the second is more a comment. Under the financial arrangements, I think it would be great if we borrow the term used in the GLG AMR technical session, which is to complete the section to read, to collect voluntary public and private contributions to support the work of the panel with a due diligence process to avoid conflict of interest, and then emphasizing while safeguarding the panel's independence. I think that would be great to add. And then perhaps lastly for this part, where we speak about the partnerships, it's great that there's the list of potential types of entities has expanded, and more specifically that you've included the private sector. Although these entities, I think, would be obliged to abide by the conflict of interest policy. In the paragraph 21, the conflict of interest limits the disclosure of information related to commercial interests, which I think might be open for interpretation. I was just wondering, to ensure the independence of the panel, it would be important to perhaps understand what this type of partnerships would aim to do, and with what purpose would we be entering into these partnerships, especially, for example, with regards like pharmaceutical industry. Thanks.
Thank you so much.
Go ahead, JP.
Aitsiba, do you want to start, and then Javier?
Yeah, thank you so much. Thank you for the comments. Regarding the composition, yes, the 4 ex officio are an addition. The 30 are the core members, and as JP was saying, there will be an open call. So it's not that we have the 30 names. It will be totally open and transparent. Regarding the financial arrangements, well noted, even though I think that it's more an emphasis rather than an addition, because it was in the document. And regarding the private sector, yes, we have crafted the zero draft of the conflict of interest policy very carefully, and knowing which are the sensitivities around, and based on experiences that were faced by other panels, etc. However, just to remind everyone that this will be subject to the finalization and approval of the panel itself. So what the quadripartite is doing is advancing that zero draft so that the panel can start operating in an agile manner. But this, if there are refinements needed, the expert committee will be reviewing and revising the documents as needed. And the idea is just to protect everyone, the panel, of course, the independence and the credibility, but even the person, because that potentially there is a conflict of interest doesn't mean that it's really a conflict of interest. So it's having the whole spectrum and then protecting everyone. And in case there is a real conflict of interest, then it's up to the panel to decide how to handle it. And regarding the partnerships, it's something that the panel will need to see and explore. We felt that it was important to leave it open, and in case there are organizations or institutions that could complement and could be implementing partially part of the work of the panel, then the panel has the opportunity to establish those partnerships. And of course, it will everyone that is involved in the panel needs to be under this conflict of interest policy. Thank you.
Javier, do you have any additions?
Yes, just one, because I understood in the question that there were questions about how the work program is defined, and this is obviously open to the request, inputs and suggestions from governments, multilateral agreements, United Nations entities, intergovernmental bodies, by anyone. And the idea is that the submissions are made to the Secretariat at least 6 months in advance, so that the Secretariat can prepare all the different requests, prioritizing them, clustering them, so that the agenda of the expert committee is prepared for the definition and acceptance of the working program. The one who is finally deciding what is accepted or what is not accepted is not the Secretariat. Just to be very clear on that, we would be just preparing the documents, but it would be the expert committee the one deciding which of the requests are considered as priorities and part of the working program. So I think that part was missed during my presentation. So I just wanted to add this part, and those would be done in a very close dialogue with both the co-chairs and the vice co-chairs. So those roles within the expert committee would be very important in the determination of the ones, the requests that are prioritized and how they are prioritized. For then the expert committee itself, the 30 members, defining which is going to be the working program for the next months to come. Back to you, Arsen.
Thank you very much, Javier and Atsuba. I noticed that there are some questions in the chat. So if the individual, so we can start off with Nasia Stanikaze. I apologize for butchering names today. If you would like to open your mic and ask the question, otherwise I'm happy to read it out for you. I'll read it out. Anna, I see your hand. I'll get back to you just now. So the question is, in the proposed founding document of IPEA, what is the standardized methodological framework will the panel use to evaluate the quality, comparability, and certainty of AMR evidence across human health, animal health, agriculture, and environmental sectors, especially given the heterogeneity in surveillance systems, laboratory capacities, and data reporting across member states? Does any...
No, we don't have the answer. I think that's why the panel will happen, actually. They will think about the methodology and they will just establish a plan. So, yeah, we need the IPEA for that as well.
Thank you. Pauline, I see your question in the chat. Would you like to open your mic and ask it? Well, I'm happy to read it as well.
She is saying in the chat that she cannot speak now.
Okay, perfect. So I'll just read out Pauline's question. Following the launch of the panel in December, when are you expecting the IPEA's work to actually begin in Nairobi? JP, IPEA, Javier, Jungsher?
Yeah. So, I mean, IPEA, do you want to go ahead?
Yeah, I think, well, in Junsha's slide, I think in the roadmap, the idea is to have the first meeting of the expert committee, hopefully Q2 of 2026, but for that, there is a lot of processes for the call for the experts to be part of the expert committee, the selection itself, etc., etc. So it would be hopefully the first semester of 2026. But for that, as I said, there are many steps before that. That would be in the optimistic and in the ideal world. But we know that then afterwards, in reality, puts you in a different trail. But yeah, we are hoping to be at that timeline. Thank you.
Thank you very much, Expert, for that. Anna, let's go to you.
Hi, thank you very much. Hi, everybody. Thanks, Arjani. It's really great to see all the progress towards establishing the panel. And I mean, I agree with a lot of the comments that it's good that you started simplifying a little bit the various structures. Also, given the resources that exist, that we know exist to develop the panel, that was clearly necessary. One question I have, in our own research, we realized that having that connection to the policymakers is an important aspect of the effectiveness of panels. And so for facilitating really good input into the operations of the panel is really important. And so I'm wondering, given that the intergovernmental body won't do that now, what are the reflections on how we can ensure that kind of input so that we have the input early on from government policymakers, but also that what we do at the panel then translates into the output that we need, that is policy relevant, that's timely, and that is being picked up by governments as well. So are there additional reflections now on, given that the structure has changed, how we can ensure kind of the timeliness and the relevance through creating really these connections with important policymakers? Thank you.
Thank you very much, Anna, for that.
Sure.
Perhaps JP?
Yeah, Jomsia, would you like to start, and then Javier will also speak about it?
Thank you very much. I think there's two directions, from science to policy and also from policy to science. So in the slide, I think I couldn't remember, maybe it's from Sylvia, the slides, or Javier.
Javier.
We link to so from science to policy. I'll start from this part. From science to policy, we see, for example, we link to the biannual ministerial level meeting. We utilize this as an opportunity to advocate, to engage with government. The second channel, because each organization, we have our own governing bodies. We will present the project, the report, the result through each governing bodies. I think this is a way from science to policy. Another way, so how we can gather the proper science. I think we also think about the different, I would say, for example, in the MSPP, we have the cluster, academia, and research. We can combine, and also under quadripartite, we have the joint surveillance, integrated surveillance team. Those are the different channels, can also combine, contribute data and science to this panel. I'll stop here. Maybe JP colleagues
Thank
can.
you. Javier, do you want to add?
Yes, just to add that, as I was mentioned before in the definition of the work program of the panel, all requests are admitted, including those coming from government representatives, as well as from intergovernmental organizations. I think your question was even going beyond that in the detail, how this connection will be made and how we are going to connect with the ministerial, etc., etc. And as it was explained before, this is not reflected today in the founding document because this is a very generic document. In the rules of procedure, we are giving some insights on how this should be done, but then it would be also part of the panel and the expert committee to define the best way to do that. And one thing that was asked yesterday, it's are we considering only experts in I would say biological science, medical sciences, or are we considering also experts on other sciences like policy sciences? And we would also consider those, and I think the input from those experts would help the panel to see which are the detailed mechanisms to really link science to policy and policy to science.
Very good.
Over to you, Arne.
Yeah, I think there will not be one, Arne, to your point. I think to me, yeah, there is this political forum that will have to present the findings of the IPEA into, but I think the uptake of the policy advice by the countries, I think that's where I think it's critical to see maybe in the coming weeks how the panel will come up with its own communication or dissemination or outreach plan to ensure that their findings really do come to make impact at the national level. Otherwise, many political fora, I think my colleagues mentioned the governing bodies of the quadripartite organizations, the ministerial conference, yes, we have looked into that. But as well, the ANGA is also part of the equation here because those are also some of this political discussion happening at that level. And now, in terms of getting the requests, again, as colleagues have said, we will be open and we encourage the member states as well to be front-loading the request to the panel on issues to be studied. Because if you send a request, you're also immediately interested to know what comes out as a policy advice. So we'll have to connect the dots from the onset of the work plan to the end of the report, and then I think the interest will be there. Back to you, Ashley.
Thank you very much for that. Joachim, I see your hand, but I'll just come back to you in a short while. I just want to give the floor to Farah, who put her comment in the chat. Farah, if you don't mind, I will reach it out. I'll read it out for you if I don't see your hand go up. So, in the proposed founding document of the IPEA, how will the panel ensure that evidence and priorities for underrepresented sectors, such as aquaculture and aquatic environments, especially in major food-producing and low and middle-income countries, are not overshadowed by more data-rich human health streams? Will there be specific criteria or mechanisms to guarantee balanced One Health representation in scoping, expert selection, and assessment outcomes? outputs?
Yeah, I think I'll go to IPEA and Javi.
Yeah, thank you very much. It's very relevant, and coming from the environment sector, it's really very pertinent. Yes, the idea is, and this is why I think that UNGA relied on the quadripartites to continue joining forces to make sure that the response is a multi-sectoral response to AMR. And this is why we emphasize that from the very beginning, for instance, with the selection of the expert committee members that are balanced at all levels, from regions, from gender, and also from expertise. So that is already giving the weight to the different sectors and to the different disciplines to be represented, because we need that full picture to make proper policy and to push for proper action. So that is the idea, and the committee, the expert committee, will have the commitment and the functions also to make sure that the deliverables are responding to the whole spectrum. Thank you.
If I can complete maybe with a more philosophical comment, the balance, the representativeness in the panel is very important for us, and you have seen that in the foundational document, trying to represent all sectors, but we have to find a balance with also geography, minority populations, gender, etc., and including sectors. And I mean, I work at WOA, so obviously agriculture, it's a very important one, and we know how this is made, but we have to assume that it is going to be impossible to make everything priority and to solve everything in the first year or in the first 2 years of the panel existence. And I wanted to emphasize something that was presented, I think, by IPEA, which is the renewal of the members of the expert committee, which is going to be every 2 to 3 years, which is generating opportunities to bring those experts on those topics that have been underrepresented in the first, let's say, season of the panel, and then trying to get those over across the time. But I just wanted to be clear on the fact that getting this perfect balance of representativeness and prioritizing everything is not going to be possible, and the mechanism of renewal of the expert committee is envisaged for doing this kind of rotation and allowing room for everyone and every topic to be discussed. Over to you, Ashley.
Julia?
Yes, I think for inclusiveness, ensure One Health participation is really critical for this panel. From an agri-food perspective, I'm thinking through very active partnership, because it's already indicated in the funding document. For example, in FAO, we have IPPC focusing on to provide plant health knowledge, and we have Codex and focusing producing food-related science and data. So we can see how we synergize and link all this data and evidence to feed and also to this panel. So those are really try to ensure really One Health participation. Thank you.
Thank you, everyone. Back to you, Ashley.
Thank you. Joachim, you've been patiently waiting. Over to you.
Thank you very much. Hope you hear me. First of all, I think it's a good improvement from the previous draft. I like the new structure. My question deals with how the expert committee is put together. If I understood it correctly, there will be some kind of open nomination, and I think I heard something about a vote. And I wonder how that will work out, because I also clearly hear that we want different fields and expertise to be represented, and how is that achieved? By a vote. If many people vote, it's not necessarily so that the top ranked will represent all these fields. So who will decide, who will adjust that voting list, or so to say, so that you get this kind of representativeness that Jean-Pierre, Jurgen, and all of you are talking about? So when we have the expert committee in place, they are the decisive body, but who is deciding who is the expert committee?
Right. Very good question. So let me start by Aitzba and then Sylvia. I'm not sure if you're still around, but Aitzba start and we come in.
Yeah, thank you, Joaquin. First round, because we don't have a panel to be selecting, so the first round will be an open call, and the quadripartite organizations will go through the list, and of course we will make sure of that balance, and will be in consultation with others like the Global Leaders Group on AMR for strategic advice. And from that, it will be the expert committee, the one voting as explained, and it's in the rules of procedure. It's a bit of maths, but we have found a way of having these staggered nominations or selections so that some members are starting, and at one point half of the members will leave, and that is the moment that those votes arrive. But it's the 30 that are sitting there that are voting the 15 newcomers, and then 15 will be leaving their place. So by having the first selection being done through the quadripartite organizations in consultation with others like the GLG, etc., then we are making sure that the initial set, let's say, it's balanced. And from there, of course, the expert committee will have that as one of the commitments. And I think it's part of their own functions to make it balanced. Thank you.
Thank you so much, Sylvia. All right, I think again to the point that Aitzba made, let's all remember that we are really at the stage of consulting the member states, and hopefully there won't be too much of again, big ask to change. And I'm just talking to you, Joachim, and the others who are appreciating the changes and the current framing. Just bear with us in case you see a small amendment. I don't know how that amendment will be. Just bear with us that the member states have this document in hands, and they're supposed to give us their comments. And some of the questions you're asking probably as well, I'm sure we'll get some additional comments from the member states to indicate on how best they think all of these processes should be conducted. But we believe that if it's through an open call and we establish the criteria that everyone understands and everyone agrees to, at least publicly, then if whoever follows those criteria still will be able to achieve what we want to have. Just the experts, the best, and representing different sectors and different areas, and then keep it rolling in that way. So Ashley, unless if someone from our colleague, our team wants to jump in, John Sia, Javier, anyone wants to comment? Otherwise, back to you, Ashley.
Thank you very much. So there's Louise, I see your hand up. I just want to take a quick question in the chat box, and then I'll come to you next. So Joshua Glazer has a question that if an organization holds a long-term agreement with one of the quadripartite organizations, can that LTA be used to support work under IPEA, or is a separate agreement needed?
I think it's completely separate. It doesn't relate. Just that's the simple answer.
Goody.
If I may, also to reinforce the fact that the panel is not an oracle, that it's producing all the evidence. Among the functions of the panel is also scanning what is out there and knowledge management and sharing information. So it's for producing, but also promoting the generation and use of that information. So all the input and the research that I know that many of the participants at this session are doing, that will feed into the panel. It's not the panel the only research or the only knowledge generation. So that will be the type of interaction that the panel needs to have to really understand what it's out and making sure that it's connecting the dots. Thank you.
Thank you, Aitzba. Louise?
Yes, thank you very much. Just to clarify, this is not a question on behalf of our funders, as I am sure you understand. So I was really just wanting to flag a point of concern that I had from the very opening slide pack, I think it was, where it was mentioned around the use of the panel to generate evidence for the quadripartite to make policy. And I was just wanting to double check that that isn't the case, that the primary purpose will be to support member states in their making of policy. So it was really just to ensure that, because I think the collective with Kevin and others, the collective concern is to ensure that there's a really specific link between the panel itself as an evidence generating body and the ministerial meetings happening every 2 years, and of course the GLG. So and having those links going both ways. So would you be able to reassure me that I've got the wrong end of the stick, so to speak? Thanks.
Right. If I may, Ashley, I think, yeah, checking if Francia, if you're around, I think you're the one who presented as well in the beginning. But yeah, I think that would be a mistake or a typo. I don't remember having seen that. Yes, I think we have the purpose of the panel from the political declaration, and it's exactly what you said, Luis, just to advise the member states into policy actions. Yeah, it's not a panel for the quadripartite. Far from that.
Okay, thank you.
Okay. I'll move over to Fasid, your comment in the chat. Given the global nature of resistant microorganisms' mobility via compensatory mechanisms and the critical need to accelerate and improve policy and action in all countries to safeguard the world, I would like to propose an enhancement to the secretariat structure. For more effective and coordinated implementation, I suggest considering the establishment of sub-secretariats or dedicated support groups tailored to the capacity and progress level of different countries, categorized broadly into 3 tiers. Pioneer/advanced countries focus on sharing best practices and innovation. Intermediate countries focus on capacity building and implementing existing strategies. Emerging and low capacity countries focus on providing concentrated technical and financial support. So thoughts or comments from the quadripartite on sub-secretariat structures?
Right. I mean, I'll maybe ask Javier maybe to talk about the subsidiary groups to see if that would be maybe responding to the question that our colleague or to the suggestion
Well,
of making.
no, thank you. First of all, we appreciate the suggestion and the comment, and we encourage you to get close to a member state representative if you want this feedback to be considered in the current consultation that is open. And then trying to answer, we believe that what you are suggesting somehow it's going to be the responsibility and the work that the subsidiary groups, the other groups, are going to carry on. Creating subsecretariat structures to help those other groups, I would say that this might be for the consideration of the expert committee and the panel itself, who would be deciding how they want to structure the work after this proposal. And I would stop here because, as I said, this is more an information session and not an opinion sharing session from what we think about this proposal. What I would say in summary is, if you want to really make this proposal, get close to your closest member state representative to make it in the written form that it's now open. And then for the rest, we believe that this function is already covered by the other groups that were presented before. Back to you, Arsene.
Thank you very much, Javier. So there was a question in the Q&A box. So I agree with Joachim. How will the first batch of 30 experts be selected, and how will their independence be ensured? There is a reference that they will be consulted with the GLG, but the GLG is not fully representative of all sectors and is a dependent structure which could introduce bias.
Right. Josia, you want to take first intervention on that, please?
Yeah, I think yes, the selection of the first 30 experts following a very open call explained, also linked to the consultation with GLG, but ensure the full independence, inclusiveness. And I think we also can think about the overall three structures involving other governing structures. So such as, for example, MSPP and steering committee, MSPP clusters. But can be, as Javier said, this is an information session, but if you have any suggestions, you can add in through your members to provide any suggestions. But we are considering the three structures work together to really coordinate well to support this panel.
Thank you so much, Josia.
Thank you. Anthony, I see your hand is up. Over to you.
Thanks so much. And Anthony So, IDEA Initiative, Johns Hopkins Bloomberg School of Public Health. My hat's off to the Quadripartite Secretariat really for shepherding this process. And like others, I'm really pleased to see how the proposal has been enhanced and improved along the way. I have two questions. One is, while recognizing that there will be a process for identifying and prioritizing topics, what are potential topics that might be capable of using existing resources and avoiding non-duplication of ongoing efforts? Having gone through this really extensive consultation process, could the quadripartite agencies provide some ideas of what they might envision as potential topics that in theory could be effectively addressed and be value added to their ongoing work within this scope? And the second question I have is, there is a strategic policy tension between using existing resources, quadripartite or separately sourced, and having IPEA carrying out value-added independent analyses. Now, those resources might be for the analysis itself, and those resources could be, of course, for the existing resources could refer to what might be actually considered within the scope of what might be implementing those recommendations. So when the evidence shows and points to recommendations that require considerably more than existing resources to implement, is it within IPEA's scope to recommend that level of ambition? Or will that type of recommendation be beyond just the scientific review of evidence? It'd be great to know whether or not, in fact, whether the existing resources modifies essentially what we're talking about in terms of the scientific evidence development process, or does it in any way limit actually the scope of ambition, in fact, of the policy recommendations that might be uptaken and then implemented? As many of course, the challenges we face will require substantial scaling up of course, the financial commitment to AMR.
Thank you, Anthony. Jean-Pierre, I'll start off with you, and then you can throw.
Yeah, sure. I mean, yes, those are great points you're making, Anthony. I think I'll come in to give my sense on your questions, but let me quickly make a round table with my colleagues as well first. Josia?
Yeah, quite really very good questions. Maybe start from the, for example, the potential topics. I think that's really this is a responsibility and the expert committee, and also maybe work together with the support from Secretariat. But if we share some initial thoughts, for example, we already have strategic framework, the global action plan implementation, how to support, and also we have the One Health priority area on research, and we have strategic framework, and so those are the documents can provide our strategic guidance with this framework. So experts, really with the experts committee can make a decision what other potential technical areas, but could link really support members implementation and link this ONGA. So the second point is about strategic resources. Actually, we have a very good funding mechanism, NPTF, which is really supporting One Health implementation, One Health approach. So this is also show how we are synergized with existed funding mechanism. So this is something in a discussion, could be in a consideration. So also here.
Thank you so much. Isabel?
Yeah, thank you. Thank you for the question. Regarding the first, I personally would have a wish list, a long one, but yeah, agreeing with Junsha, for instance, the One Health Priority Research Agenda on AMR that was involving a number of experts had a long list of topics, and yeah, there are many on the table, but it is totally up to the expert committee to decide. Regarding the existing resources, in the functions that are suggested in the revised funding document, one of the functions of the panel is the policy support, and in there is developing tools and methodologies based on the deliverables to guide decision making at all levels. I think that is opening the room for the panel to also suggest how those decision making bodies or how the summary for policymakers could guide the action. So I think there is room there to suggest a higher level of ambition, not necessarily staying at the existing resources. If I understood correctly the question. Thank you.
Yes. Javier, anything to add?
No, just to mention that the process for determining the work program of IPEA, it's one of the documents that is available in the QGS. It's a 2-page document describing very precisely how the proposals are to be made and how the decision process is there. As everyone, I think here in this conference, we all have our wish list, but it's not for us, and it's not because we are quadripartite to make those suggestions. It's for everyone who would like to make the suggestions, and I would just like to emphasize one of the points that is described in this document is that the submissions should, if possible, be accompanied by information on the urgency of the action and the achievability of the action that is proposed. So I think there is also a balance to find between the impact of the proposals and the achievability of the proposals so that we can move on a stepwise approach and not just hit for a target that is taking us to Mars, while maybe just staying on Earth is just simply enough to start solving the equation, if I may use this analogy for responding to your question. Over
Thank
to
you so
you,
much.
Jake.
I think, Anthony, as you can see, all colleagues are turning back the question back to you, because again, we don't want to be actually the ones, setting up the priorities for the panel. That would be wrong. I wish could be the member states, the implementers, telling the panel, here is where we need your advice. Quadripartite will be among the hundreds of other stakeholders who will send these questions to the panel. So that's the answer. Otherwise, everyone has a list. I'm sure you might also have some list already somewhere where you think like these are the key areas that the panel should be focusing on. I think the key will be it's really an open for everybody to send those questions out, and then a clear process of prioritization and voting on the final ones to start with will be key. Now, on your point on resources, yes, the panel will really be, to me, providing advices spanning across all the elements of AMR response. So financing or resource management will be one of those. And even if we say that their report or outputs will be, our aim or our idea is that they are discussed at the governing bodies of the quadripartite organization. But we know decisions around financing do not necessarily happen at the quadripartite organizations. So the World Bank and development banks. And so the panel should really have a strategy that reaches out beyond the usual One Health sectors that we usually call ourselves to. Like, it's not really about animal, agri-food, health, and environment. I think to me, their functions or their outputs should inform beyond that, including the resource part of it. Back to you, Ashley.
Thank you very much. Yamaya, I see your hand has come up again. Please go ahead.
Thank you so much. I was actually hoping somebody would raise my point so that I didn't have to say it, but then no one has. So just a quick question. The expert committee is now taking up the leadership roles that were previously held by people that would be nominated by government. So what I assume would have been government officials, presumably remunerated by their respective governments. Is there any idea or understanding on the plans for remuneration of the committee members in this new organization setup? And then my last question is, is there also any thought towards an evaluation that can be done after like a pilot phase of the panel's work, possibly to guide work going forward and potential adjustments made after such an evaluation? Thanks.
Thank you. Colleagues, let me come to IPEA.
Yes, thank you. Regarding the selection of the members, as we were saying, it's an open call, and at one point it's the expert committee, the one deciding, and hopefully by consensus, but otherwise by vote, which are the profiles needed to replace 15 of the members, and then it's a rotation. So next term would be the other 15, the ones replaced. The first list, because we don't have an expert committee to decide, the suggestion is the quadripartite organizations through a transparent process, receiving the nominations and then selecting those 30 individuals based on merits and based on the criteria established in consultation with, for example, the Global Leaders Group on AMR to guide strategically. That is the proposal. And as my colleagues were saying, if there are other better ideas, please channel them through member states, and because until 25th, we are open to those. Regarding the evaluations, yes, among the functions of the expert committee in the funding document, there is one concrete function that it relates to external evaluation. There are different functions that are related to the normal day-to-day, and the Secretariat, for instance, has to report back on the progress, etc., etc. But there is one function on the among the ones that the expert committee has, that it's making sure that the terms of reference for external evaluators are done, and that we don't specify how regular, but that from time to time the panel and its results are evaluated by external partners. So it's included in there. Thank you.
Right, thanks. Anyone from colleagues? John-Pierre, Javier, Sylvia, John-Pierre, Javier. Just to your first comment, if I just understood it clearly, I think you were asking as well about remuneration, right?
Exactly, yes.
No, there won't be any remuneration. I think, it could be logistic support for meetings or whichever mission is being to be undertaken, but there is no remuneration. We believe this won't be a full-time job, not even qualifying for this. And that's what we have in mind so far, and that's what we put in the document.
Perfect. It's good to know.
Apologies, I understood nomination and not remuneration.
No, that's fine to emphasize as well on that, Aitzida. Ashley, back to you.
Thank you. The questions are coming in, colleagues. So next question, how will IPEA interact with the other governing structures? There are some mentions in the founding document of the MSSP and the GLG, but further clarity on their interaction would be welcome. Linked to that was also a question that was posed by Amaya about, agreed, what mechanism will these organs employ to effectively disseminate and ensure political uptake of panel recommendations? The roles of these two governance structures should be more specific in terms of the oversight provided or required of them.
Thank you. The first one will go to John-Pierre about the governing structure, not the governing structures, rather the governance structures of AMR, how the coordination will work, and then Javi, if you could take the last one as well, would be helpful.
Yeah.
Please, your cards.
And regarding the three governance structures, they have the different roles of the three governance structure. The GLG mainly provide the high-level political advocacy guidance, AMR. It was involved in the consultation. It was mentioning in a funding document. And then the panel, because this scientific policy advisory group will conduct assessment, including this horizontal scanning, different, the key functions. And the MSPP facilitated broader stakeholder engagement consultations. So the MSPP can translate the evidence into action, engage stakeholder, provide practical some actions, insights, support both the panel and the GLG. But regarding this evidence panel, well, I think the panel can also use MSPP to enable participation and streamline inputs from the diverse different actors. Again, if you have any good idea, so for us, for the quadripartite joint secretariat, we would like to coordinate well between the three governance structures without any duplication, but focus on implementation action. But if you have any good ideas, we would be very welcome. Thank you.
Thank you so much, Javier.
Yes, thank you. If I understood, the second part of the question is more related to the link between science and policy.
Exactly.
And policy to science. And as we mentioned that before, we are planning to use existing mechanisms, especially the ministerial meetings, for that. And then how to do that in the details and how to ensure that, if I put it in very simple words, how to ensure that the ministers, when they meet every 2 years, they listen to what the panel has said, or they read what the panel has said. It's a joint work also with the expert committee. And as I said before, we are not only thinking of getting experts in this panel about biological sciences or medical sciences, those who are specialists in political science, in social sciences, would be very helpful to build and to determine how we can make those links. Because formally, we could establish that formally with saying that whatever, building something which is saying that what the panel is saying, it must be considered by these different policy bodies, and whatever these policy bodies is deciding is legal binding. But if we go that route, I think we would be just taking years and years to make one single decision. So we believe that this model of functioning, even though it's not set in stone and very thoroughly described how the connection will be made, is giving both things. It's giving two things. It's giving room to include political scientists and social scientists, as well as agility to throw these recommendations to these to these policy bodies, and trying to make things different. This is what I think we can say at this stage. Over to you.
Thank you. Ashna.
Thank you very much. Iruka, you put your comment in the chat box. Would you like to open your mic and ask it? I see you're still online.
Sure, I can ask the comment. Thank you, and thanks so much for the questions that have been asked and answered so far. They're really happy with the newer draft. In the event that an open call does not result in the geographic diversity, the diversity in sectors, and so on. I mean, the document says that there'll be an open call, and from the submissions in that call, the initial panel will be selected. And we hope that, the pool will be very diverse. But in the event that it's not, does the panel press ahead? If it does press ahead, there's the risk that the existing panel will recreate itself on turnover. Or is there a plan for an intervention so that we do get the diversity that we'd like to see? So basically, my question is diversity something that we desire, or diversity something that we say we must have for the panel? Thank you.
Thank you so much, Iruka, for that good question. IPEA, do you want to start?
Yeah, thank you. And I was looking for the concrete paragraph because in the funding document, section 2 is institutional arrangements for the panel, A is expert committee, and in the membership, it's para 4.
Sorry, I meant the expert committee. I shouldn't have said panel, the expert
Yeah,
committee.
the expert committee of the panel. Yeah, perfect. It's there. In para 4, it's mentioned that members participate in their individual capacities, and they are nominated and selected through an open, transparent, merit-based, and competitive process. The selection process ensures inclusive participation and strives for balanced representations across geography, sectors, gender, and disciplines, including representation of indigenous peoples, regions severely affected by AMR, and experts in economic, social sciences, and other relevant fields. And again, it's details on the terms of service and nomination procedures and selection criteria are in the rules of procedure. But already in the funding document that it's now the focus to establish the panel, we are explicitly including the need of being really inclusive. So to reassure you that it's in there.
Okay, I guess I saw it there. I guess I'm trying to understand what strives for means.
Yeah, so let me try as well to bring that in. I mean, it doesn't mean we have all the answers, right? We're just describing what we're already putting the documents, and we're basing on the existing way we operate. I mean, even when we are constituting the GLG, we try to be balancing sectors, the regions, and so forth. The first way you ensure that is how do you reach out? You know, it can be an open call. That's on a sophisticated website somewhere that you don't even, have many people to look at. So the idea we have is that we could write openly to countries, disseminating this call, right? Then second, we trust that in every corner of the world, really the expertise exists, but the opportunities or the knowledge or the information has not been flowing on that place. So we actually think we'll get more than really completely missing out. But I would not say that it will be really something only to consider lightly. I think from the discussion we've had with the member states since the beginning of this discussion, actually, which dates very long, I think 2019. I mean, the idea was that this panel should really be balanced and should really be considering highly and inclusive to all the geography, including the LMIC. It has been really made very clear that it has to be really much sectoral. It has to be, balancing or representing different constituencies. So I think the key or where we'll fail is how we're going to be really communicating and calling for experts to apply. And then it's a call to all of you, everybody, and your networks. So just don't ignore the call when it's out there. Embarrass us by really having many and from everywhere, and then we will have a better issue rather than because I'm emphasizing on that because there is also some perception that the AMR knowledge and expertise lies in one geography or in one part of the world or in one sector. And to me, again, I hope I share that with many. I think it's not true. I think we need maybe to be, the way the criteria will be prepared, the way the announcement will be made, the way outreach and communication will be done is going to be really preparing for us to succeed or fail in terms of having a balanced and I would say, put together panel. So, yeah.
Thank you so much, Ativan JP. Thanks a lot.
Thank you very much for keeping, and to everyone for their questions, for keeping the quadripartite on their toes. We move on to Susanna's question, which I think is linked to what Aruka had just asked. Susanna, do you want to?
Oh, it's not a question, it's just a comment. Just based on what's been said. I haven't got a suggestion to do it any better. This is as good as it gets. It depends on the nominations. We all have to nominate good people and hope that they get into the committee.
Really?
But I think in fair that it doesn't repeat itself as you do this turnover, and to ensure that diversity and balance. So there's one of the comments in the Q&A. I understand member states are providing written input. Can you confirm whether there will be further negotiations with member states before the process is complete? I assume beyond 2020, beyond the 25th of November, is that done? And
thank you. Georgia, do you want to take on that?
I think based on, I present the timeline because initially we are ambitious. We want to launch, but now JP already explained. So I think this is the main channel. Currently, this is the main channel for written comments. But maybe JP, I will rely on you. Do we give another opportunity for negotiation? So I think that suggests using the main channel, the members' inputs through the four organizations. So because we all want to have this panel, the sooner the better, and we are looking forward to this panel functional. So, but JP, maybe
thanks. I mean, I agree with you, Jongxia. First, we have a roadmap that probably all of you have seen, and we're sticking to that. So we want to finalize the funding document as it has been requested to us by the ANGA, by the member states. However, we are open, depending on the feedback we get from the member states by 25th of this month. We'll just be considerate of their comments. And then we'll work on an improved draft. If it's doable, we'll still have to finalize it by 10th of December, and that's what we wish to do. And then other documents can be finalized later. Now, in terms of, first also to clarify, we're not intending to do a negotiation. What really is key to us is to be transparent, open, and inclusive in the way we consult. So we are doing consultations, including the member states. Now, whichever draft we're going to come up with next will again be public. So all of you, you'll see it. You'll see it. And even the next steps will be communicated to you. Again, we also hope that the panel functions or the panel operations will still be transparent and open to all of us. So you don't have to be necessarily a panel member or an expert or an observer to probably be able to understand where the panel is heading or what the panel is coming up with. Yeah, that's how we are envisioning the process moving forward. Ashna, back to you.
Thank you very much, JP. Jose Luis, I see you put a question in the Q&A box. I'll give you a second to open your mic and ask it, otherwise I will read it out. Okay. Considering that global AMR policies have been structured from a one-size-fits-all approach, how can we ensure that the proposed solutions are sensitive to the realities and worldviews of Indigenous people whose traditional health practices may differ significantly from Western biomedical models? What role should ancestral knowledge and community-based practices play in the development of public policies to address AMR?
Thank you. Javier?
Thank you very much. I think it's very well specified in the foundational document that the representativeness of every geography, culture, indigenous peoples, etc., must be part of this panel, must be part of this expert committee. Then whether the traditional medicines or different approaches on how to fight infectious diseases, how to contain the development and the spread of AMR, how they can be considered for policy decisions, etc. It has to be scientifically based and evidence-based, and I think this is the role of the panel. And as it was said before, this is one of the main reasons why we need the panel, because we need these scientific evidences and these a strong scientific advice to make proper policy decisions. So we are not here to judge whether something is right or something is wrong between modern medicine or ancestral medicine. I think this is the main role of the panel based on the scientific basis and the evidences around those things. Knowing that these cultural populations are to be represented in the panel. Back to you.
Thank you, Ashley.
Thank you very much. I don't see more questions either in the chat or Q&A. I don't see hands. I'll give you a moment just to think if there are any burning last questions. Otherwise, I will give back 20 minutes or 19 minutes of your day. So just give us a second while I also find my notes. So what do you think about that? Okay. As I don't see any hands or new questions, so I think I'll take the opportunity and the liberty to end today's session early. So firstly, thank you to all of you for your very rich, engaging, discussions from the quadripartite. We hope this was a useful session for everyone to receive the latest updates on the process and the next steps. Also, thank you to my colleagues at the quadripartite for their time and all the useful information that they've shared, and also, staying strong as they've been grilled in this process. We understand that following the consultations with the governments, with the deadline for submission is the 25th of November, the quadripartite organizations will finalize the document and aim to present the founding document in December during the UNEA side event scheduled for 10th of December. The MSSP will continue to share updates on the process through our monthly newsletter. If you have any questions, please contact the QJS Secretariat. The email will be put into the chat box. So thank you all for your participation and have a fantastic Wednesday and enjoy the rest of WOW.
Thank you so much, Ashley.
Thank you. Bye-bye.
Thank you.